So you've mentioned pillars a few times. Could you tell us a little bit more about what that means in the context of Animal Trust and its objectives?
Yeah, sure. So what we're looking at doing for our strategy is to have 4 core pillars. So for our patients, we're always wanting to give safe and meaningful care. So to me, that means that we learn as to what treatments really make a difference for our pets. It's not about giving every pet treatment that medicine has available at all, but it's how do we help as much of our pet-owning community as we can access care, and how do we make sure that when we do that care, it brings a real benefit for them and it's also safe to do. From our employee element, we really want to give everybody a career that's full of purpose, it's full of learning, and where people use their skills. So we mentioned about never stopping learning in the values, and we really want people to upskill during their time in Animal Trust. We want them to use those skills, but we also want them to feel the difference that those skills is bringing to their patients, which ultimately is why most people enter the veterinary profession, is to do that. So our projects are very much geared towards that, to upskilling people, using those skills, and then seeing the benefits that happen. And that sort of ties in with one of the other pillars, which is about how do we help our communities reach veterinary care. So when we're choosing what we do, where we open, services we offer, how we run, we want to be having that check of, does this help the community access veterinary care? Is this what this community needs? And therefore, are we driving social benefit? How are we impacting them? How are we helping them? And then the final sort of pillar that we've got links in with all of those other pillars, and it links to our infrastructure. So we want to have consistent and effective facilities, information and systems. So we want everything that we put around our staff and everything that our clients come into contact with, or that our patients experience during their care, to be effective, to work well, to be beautifully simple, and because of that, it to be safe. And we know at the moment, lots of our sites and things are quite different, and that's something we want to learn and bring in the best of staff to make sort of robust, safe facilities wherever we have them.
Okay, so you've got your 4 pillars, and this is part of, is this an ongoing strategy, an evolving strategy? Is there checkpoints along the way? Does it span 6 months, 5 years? Where are we looking here for an achievement perspective?
Yeah, so I think achievement happens at every point along the strategy. So sometimes those are large milestones that happen with big projects. Equally, they can be really small things that can happen on a surgery or an individual level as well. We're really looking in terms of building things out. Most of the projects we have at the moment are looking at up to sort of 5-year span, and certain elements, like I mentioned previously, about within 10 years everyone being within an hour of an Animal Trust, or on a slightly larger time horizon. But at every point in that, there will be bits that link into that strategy, and then over time, of course, focuses, priorities, they change a little bit as the world changes and as veterinary changes.
Yeah.